Uterine fibroid. It's also called leiomyoma. Well, it's very important in AMC exam. First of all, it's a tumor, it's a benign tumor of estrogen hormone. And the most common area is intramural fibroid. There are multiple areas of the fibroid, but the most common one is intramural fibroid. Look at this picture here on the top right corner, and this one represents intramural fibroid, which is the most common one. The clinical picture include majority of cases are asymptomatic, and in case if it becomes symptomatic, then the most common symptoms is a bleeding. Okay? The idea of a bleeding is that this mass inside the myometrium, it will prevent the myometrium from contract normally, and that will lead to bleeding because myometrial contraction will make squeezing of the vessels of the endometrium, and in this case this will lead to bleeding. Okay? Now for the treatment. The main treatment of it is treatment of menorrhagia. And the main treatment of menorrhagia is by using OCP, low dose oral contraceptive pills, and other options. If the female young and this female need kids, then the treatment of choice is myomectomy, which is the treatment of choice in general in case of uterine fibroid. And remember, you should always give the patient GnRH hormones for at least 3 to 6 months before surgery in order to decrease the size of the tumor. Then you should make myomectomy. Okay? Don't forget that. And if the woman old age and does not need kids anymore, then the treatment of choice will be hysterectomy in case of excessive bleeding. Okay? It's clear and it's simple. Complication of fibroid. The most important one is regeneration of the fibroid. It's also called ischemic necrosis. It's occur in case of pregnancy. Focus on this very well. During pregnancy, the estrogen will increase, and that will lead to increase the size of the fibroid. But the blood supply will remain the same, and that will lead to not enough blood supply to this fibroid tissue, and it will lead to necrosis. Okay? This is the pathophysiology of it. The keyword for regeneration of fibroid is that abdominal pain and fever in a pregnant woman, and this woman has history of fibroid. Should be history of fibroid in this woman. You cannot say regeneration of fibroid without history of fibroid in this woman. So abdominal pain, fever, and pregnant woman with history of fibroid. For the treatment, it's just analgesia. Not more than that. That's it. For full course, please contact us through amcqbook@gmail.com. And please, if you enjoyed this video, press like button and subscribe to the channel. Thanks.